Hi. So today we are going to discuss on a most important topic. That means, is cancer preventable? Can you stop or can you do something to stop getting cancer? The short answer is it's preventable to an extent. If you look at the new incidence of cancer in India, it's around 15 lakhs per year. And among that, more than 50% of cancers are due to lifestyle or lifestyle related disorders. So the most common lifestyle related disorder which we should discuss is something called our food, what we eat daily. It has been proven in clinical trials that if you take high fat intake with low fiber, it has got increased incidence of cancer. High fat intake means they tell red meat. It may be in any of the forms, in any of the meat, or high saturated fat intake. And along with that, you decrease the fruits and vegetable intake. It doesn't mean that this video is not to panic you and ask to stop taking red meat. You have to limit your intake. Along with that, you have to increase your fibers, and fruits, vegetables intake has to increase equally or more. At a time, red meat intake is okay, but having it daily in your plate is not going to be a good thing for your body. The most common cancer which is related to that is something called the colon cancer. There are other cancers also attributed towards your dietary intake. Other than the saturated fat or red meat intake, there are some other diet and cancer relation. For example, the barbecue or salted meat, that has shown that it releases something called polycyclic hydrocarbons. So having it routinely is not good for you. It has got increased incidence of gastric cancers. Third is something called the preservative foods. People are moving towards a preservative food type of pattern because of the problems in their or because of their busy work schedule. But you have to prepare the food fresh as possible. Preservative foods are not good. And reuse of the oil, that's very important concept which has come. That means in many of our households, we reuse the same oil the next day, the other day. So reusing the oils releases this carcinogens. So I think so the oil intake should be limited, that is true. But more than that, reuse of oil should not be given or should not be encouraged. We have to educate all our household people, whether it's a mother, a wife, or the husband who is doing the cooking. You have to educate them. Other than that, in lifestyle or the preventive cancer, our bad habits are one of the most common cause of cancer in India. More than 50% of cancer is due to tobacco and tobacco-related products. So in any of the form, whether it is smoking, chewing, inhaling, ingesting, whatever way, the new one called the drug addiction, or even your alcohol intake. As of now, the new studies show that there is no safe limit for any of these things. Quit smoking, don't take up the habit of smoking. Even a small amount of alcohol ideally is not safe is what they tell. Lifestyle disorders has got an impact of exercise. So doing a regular exercise, physical activity, improves your healthy cell. It helps for the weight reduction because obesity and cancer is very much related. So if you don't do a exercise, so you have an increased overweight, abdominal fat deposition, obesity, it has got increased incidence of cancer. Mainly the endometrial cancer, pancreatic cancer, esophageal cancers are related to obesity. So make exercise a part of your lives. There's no studies yet to show that mental stress produces increased incidence of cancer. But I always take it a point to discuss with my patients and their bystanders that mental stress is an equally important thing which you have to give attention to. Because when your mental stress is good, your physical activity improves, your food intake limits, or you know what you are supposed to do, and a healthy lifestyle is always a byproduct of a good mental health. So I think so we should focus on whatever way we can prevent this disease. Thank you.